Welcome and thank you for attending our Security Health Plan Life Focus webinar exclusively for our Life Focus employer groups. My name is Angie Pirro and I'm a health educator here at Security Health Plan. Before we get started, it's important to mention a few things. One, the information provided during today's webinar is designed for educational purposes only. It is not intended to be a substitute for informed medical advice or care. You should not use this information to diagnose or treat any health problems or illnesses without consulting your provider. Please consult a doctor with any questions or concerns you might have regarding your personal health. A few other housekeeping items. Remember to have your speaker's volume on your computer turned up. And if you do have any questions during the webinar, please use the Questions tab on the control panel. We would also encourage you to monitor and use your chat feature where we will discuss today's webinar topic. The webinar will be recorded and archived for later viewing, so if you miss anything, we definitely encourage you to join us again and view it at a later time, or to also share it with your employees and coworkers. Shortly following the webinar today, you will have the opportunity to provide us with feedback on the webinar, and we encourage you to take a few moments to complete this evaluation. One more item. If you are participating today as part of a workplace wellness incentive program, please keep in mind that if you are viewing the presentation as a group, you will need to contact your wellness representative to learn more about how to confirm your attendance. We're very excited today to have with us Zen Rupal. Zen is a pharmacist, and she's going to talk to us about getting the most from your medications. Now, I was speaking to her earlier in the last few weeks and even today, and she definitely has a wealth of information to share with us and a lot of experience. So I'm going to actually let her introduce herself a little bit today to share with you kind of her history, where she's coming from, and her topic today regarding getting the most from your medication. So thank you so much for being with us today, Zen.
Absolutely. Thank you, Angie, for that lovely introduction, and thank you, everyone, for taking the time and spending the next half hour with me. As Angie had mentioned, my name is Zen, and I'm actually a clinical pharmacist and special projects coordinator for the Family Health Center Pharmacy. And the Family Health Center program is a community health center that services most of northern and northeastern Wisconsin. So we do cover a wide geographic area. One of the goals as a community health center, what we do is try and help patients better manage their own health and manage their own care. And of course, in our ever-changing healthcare environment now, medications play a huge part. So what I'm hoping today to do with you is to be able to help you identify some key information that may be useful in you understanding your medications and managing your medications, and then explain a little bit about how pharmacy, and not just our pharmacy, but your pharmacy and any pharmacy that you can go to, how they may play a role in helping you manage and understand your medication. And throughout the presentation, there will be a lot of information, but hopefully pretty straightforward, and we definitely welcome questions. I believe we will be addressing those at the end, so please save your questions and input them towards the end of the presentation. I will be happy to address them. So there's a lot of medications out there, and when you're watching TV or reading magazines, it seems like every other advertisement for a medication. But hopefully this isn't what your medicine cabinet looks like, but there's a lot to keep track of. And according to the Center of Disease Control and Prevention, or the CDC, by 2007-2008, 1/2 of all Americans use at least 1 or more prescription medications. And 1 out of 10 use 5 or more. And if you're, on the older side, and the government classifies that as 65 or older, 40% of older Americans used 5 or more prescription medications in the past month. So that's a lot of medications. And in the profession, we have a term for words like that. It's polypharmacy. Basically, there's a lot of medications to keep track of. So what I'm hoping today that we can walk through is kind of a strategy or approach to say, where do I start? How do I keep all of this medication straight? So let's the very beginning then is what happens, how do you get a medication? Well, most of the time people think of prescriptions, and you have to go to the provider's office and get a prescription. Well, before you start that medication, there might be a few things that you want to ask specific to help yourself understand. These are 3 key pieces that we would like patients to understand and ask before you even start taking the medication. Number 1, why am I to take this medication? What's the reason for it? Is there a new condition that I'm being treated for? Is there something that's amiss that I'm missing? Or what is this medication going to do for me? Number 2 is, what should you expect? Is this medication going to cause any problems, cause any adverse effects? Is this going to help me in controlling my chronic conditions? And then number 3, kind of tied into number 2, is how will I know it's working? And we all know medications are not cheap now, and depending on your co-payments or how you're paying for it, part of it kind of is looking at what you're getting out of your investment and paying for the medication too. So these are 3 key questions we like for people to ask and patients to ask before you start medication, but you may also have other questions at this time. And if you do, my biggest tip here is to ask. Please ask any questions of your provider or provider's office before you start on a medication. And it is ultimately your decision whether or not you want to take the medication, or you should, and work with your provider's office to make an informed decision. So once you have that prescription in hand and you step to the pharmacy and you obtain your medications, what now? What should you know? Well, for any medications that you're taking or you have been on chronically, these are some key pieces of information that you should know. And I'll just list them briefly, but basically you need to know the medication name, the dose, which is often the number, or they come in milligrams and milliliters right after the name of the drug, how you should be taking it, and how often you should be taking it. And these directly relate to helping you get the most out of the medication you're taking. Number 1 is how you should be taking it will help you avoid unnecessary adverse drug reactions. And I'll give you an example. If something is supposed to be taken with food and you take it on an empty stomach, it may cause you more stomach upset and cause you to stop the medication prematurely or not take it. And how often you should be taking it is very important too. There are certain medications that even though you may not feel any different, you have to take a certain number of times a day or multiple times during the week, and it's very important to understand exactly what those directions are. You could help, by understanding that, you can help avoid wrong dosing. And if you've ever been to the provider's office recently, they'll often ask you these questions, and that's part of a reconciliation process that the providers do. They would like to make sure that what they have on record is, in fact, what you're actually doing. And by understanding this information, you will be able to make sure that the provider's office has the most accurate record of what you're actually doing. So ultimately, knowing this type of information will ensure that the medication is working appropriately for you and make sure that you're getting the most out of it and identify any problems that you may have. We talked about prescription medication, but I know a lot of you probably do other things for wellness, and one of the areas that we often get questions on in pharmacy is about prescription, or excuse me, over-the-counter non-prescription vitamins and herbal supplements. So I just wanted to offer a little bit of information about those types of products. And I don't know if you knew that or not, but this FDA, the Food Drug Administration, actually doesn't regulate over-the-counter vitamins or herbals. There's an act that was passed in 1994. It's called the Dietary Supplement Health and Education Act. And that was really groundbreaking in 94. DSHEA, I'll just for sure, basically ensure that these products that are sold are just safe before marketing. But they don't really regulate them like they do with prescription medications. So what that means is no one really can guarantee that when you pick up a bottle of over-the-counter that it's got exactly, the amount that they're advertising, or it doesn't contain other products in it. Now, it's not to say over-the-counters are dangerous to take. Of course, there's reputable brands that are often recommended. But if you're looking for a vitamin or supplement or other, I guess, various multiple generic makers of supplements, one of the items that you can look for is this insignia here over on the lower right corner, and that's from the U.S. Pharmacopoeia. The USP is a private, non-for-profit third party that actually validates and verifies these herbals and vitamins for their ingredients. They make sure the ingredients are on the label is what's in the container in the marked potency that they advertise for. They make sure that these supplements don't have any harmful levels of contaminants. And they make sure that these products will break down and release in the body in the way that it's advertised in a specific amount of time, and that it's being made by good manufacturing practices with sanitary and basically well-controlled procedures. So it is another form of validation that when you can see that insignia over there, that logo on the right corner, those are generally what pharmacies will recommend more, those particular brands with that insignia for over-the-counter medication. So I know that was very brief, but that was one of the more common questions that in pharmacies we do get is, well, if these two vitamins, both are vitamin C, which one would you recommend? And so hopefully that would be a helpful tip on your next trip down in perusing and shopping. So the final piece that I like to mention in this prescription scheme is when you take the prescription home or take the medication and products home is keeping you safe while it's at home. And two areas that I want to talk about, storage and disposal. So contrary to popular belief, the medicine cabinet is probably one of the worst places to store your medications. Because oftentimes it's located in the bathroom where there's high humidity, intermittent, and there's opportunities where accidents can happen. Bottles get knocked into the sink and it comes in contact with moisture, or pills get lost. So we don't recommend storing your medications in the medicine cabinet in the bathroom. We do recommend storing them in a safe location away from children and pets. And I don't know about if you had personal experience, but I find it very difficult for pets to take any sort of medication, but there has been known to happen. So children definitely, and I'll share a key piece because this happened in Wisconsin, and it was very tragic. And last year there was an incident where a 2-year-old toddler was visiting a great-grandmother, and it was a nursing facility, so not in the home, but it does affect with storage and disposal. And the grandmother was on a pain patch, very strong pain medication. Unbeknownst to the parents and everyone around him, he had picked up this pain patch that was improperly disposed, put it in his mouth, and a piece got dislodged when he was chewing it and stuck in his throat. And so when he became unconscious a few days later, was unable to be revived, and they couldn't figure out what to do. Unfortunately, this toddler did die because a piece of that pain patch was emitting the medication in his throat for the past 2 days. So it's tragic and it's serious, but it serves as a good reminder that storage and disposal does make a big difference. And if you ever encounter those types of situations, call 911 and call the Poison Control Hotline. The 1-800 number is 1-800-222-1222. They have experts on hand, but let's prevent those situations from happening and store your medications in a safe place that's convenient for you, but also away from anyone else that may be harmed by it. And if you ever have any questions about disposal of your medications, please call your pharmacy, and every pharmacy should have access to resources and information for you. And oftentimes, unused medications, the police departments have areas where you can drop off your medications to be disposed of. So other than you having to take and manage your medications, what else do these things have in common? Well, I like to propose that it's a resource. It's your local pharmacy. And One of the slogans that we like to have patients understand is know your medications, know your pharmacist. And your pharmacy and pharmacist that can serve as a great resource for you. And if you think about it this way is, oftentimes you have different providers that you see and different facilities that you visit for your care, where the pharmacy is really the only place that houses your centralized medication records. And it's a place where a complete picture of what you're taking exists. And so when you need help understanding your medications, you can solicit your pharmacist a medication chart or a comprehensive medication review, and that includes the over-the-counters and herbals that we mentioned previously. They can come up with a chart that has a list of your medications and your dose and how you're to take it to help keep you organized, and then also to serve as a record for all the other providers that you may be able to see. And this serves in the complicated healthcare world that we live in. This serves as a good, home for your medication record if you end up having multiple providers or having confusion about it. And, talk to your local pharmacist, and you'll find that a lot of pharmacists are happy to help. And some people are intimidated by the hustle and bustle, where when you're picking up a prescription, it seems like there's rarely any time to talk to the pharmacist. But if you have this special interest, please place the request. They oftentimes can set aside a time for you to talk to you. And I know that Security Health Plan is also offering fall wellness days that you can sign up for. And there, as part of those wellness visits, there is a part where pharmacists will be available by appointment, and there will be pill organizers available to help keep you organized too. So, but if you have any further questions, please feel free to ask, and we'll be happy to get more details for you. So I know that was a lot of information. I went through it rather quickly, but I'd just like to summarize by saying that there's a lot to keep track of when it comes to your medications and products. So please just remember that the key part of this whole picture is you and your understanding. And so please, when you get a new prescription or start a new medication, ask questions. Understand when you're taking a medication, the details of how you take it and what to take. And that includes over-the-counters and herbals. And then please keep your medication in a safe place and dispose of them appropriately. And hopefully these tips will help you formulate a successful plan for managing your medication. And as a last piece, I'd just like to offer this key tool, and hopefully this will be a short little post-it that would be helpful when you go into your doctor's office the next time. It just has a brief listing of medication names, the dose, what the medication is for, how you take this medication, when and how often, what can you expect, and how you know it works. And I think people mostly understand the top four, but don't always ask the last two. So what you can expect and how you know it works, because that'll tie in directly with when you need to follow up with the provider and avoiding any adverse drug reactions. Well, thank you so much for your time, and at this time I'd like to turn it back to Angie to address any questions that may have come up.
Thank you, Zen. That was great. I think that medication is something that impacts everybody on a daily basis in one way, shape, or another, whether it's themselves, a family member, a friend. And the items that you touched on today are definitely eye-opening, so thank you. Definitely want to encourage everybody now to bring forth those questions. I welcome you to do so. And we do have a couple questions that have come in already. And one of the questions then is, are there cases where name brand medications are better than a generic?
That is a great question, and we do get that often. What the FDA regulates is that generics should be equivalent to the brand name. So when your doctor prescribes you a brand and at the pharmacy you pick up a generic, that drug should work as well for you as the brand medication. So that's the short and simple answer. The complicated answer is oftentimes a lot of generics can be made by different manufacturers, and there's a variance in what's acceptable and what's allowed. So you may have generics that have, a little bit less than the brand, but you may have generics that have a little more than the brand in terms of active ingredient. And if you're ever in a situation you're finding that the generic's not working for you as well, it doesn't hurt to see if you can try another generic first. And there are allowances for if you failed multiple generics and only the brand name medication works well for you and you have a medical need. It's called a brand name medically necessary, and most insurance companies will have allowances for that, and that's something that you could talk to your provider about. But please have confidence in generics. They are less costly for you, less costly for the system, and 90% of the time I like to say equally effective. So.
Great. Thank you, Zen. Another question we have here is, how long after a use-by date is medication still effective?
Definitely great questions today. It depends on the medication. So when you're looking at your bottle, and prescription bottles will often just say best by, this date. Generally, the pharmacist will not give you short-dated products, which means expiring less than 6 months. If they do, they're required to tell you, or they should tell you exactly when the product expired. So most of the tablets and capsules that you get in a prescription bottle will be good for a year from when you pick it up. Now, on things like inhalers or other products that you have a manufacturer expiration date, it's usually good until that manufacturer expiration date, but certain products, once you open up the packaging, the expiration date becomes shorter. The most common example I can think of is nitroglycerin or nitrostat tablets, the little vials that people take for chest pain. They're good if you don't open them until that date that's on the vial, but once you open them, they're only good for 6 months. So if you have questions or if you're unsure, please call your pharmacy and they can verify for you. But in general, if it's been over a year, I'd recommend calling your pharmacy or discarding that medication. And I didn't go into detail very much on the disposal portion, but disposal of medication is a key element now, and we don't want all of this medication ending up in our water supply and in our, or in areas where children and pets can access them if you just throw them in the garbage. And so proper disposal is highly encouraged, and you can take it, like I said, a lot of the police stations will have areas where you can take the medications to. And I would encourage that if it's something like a strong pain medication or even hormone therapy or different types of products, to mix it with a different product and dispose of it. And they actually recommend now, because of that incident that I mentioned about the toddler, those really strong pain patches be folded in on itself and flushed down the toilet. I'm not sure how water works. They appreciate those patches being flushed down, but that is what the FDA and the DEA is recommending as the safest way of disposing those.
Great. That's great. Thank you. I know from personal experience, just dropping the medications off or that have expired at the police department seems to be a pretty safe method to go, only because they know exactly what to do if it's a liquid, if it's a pill, or if it's something like an inhaler. There's so many different forms of medication that they tend to know exactly what to do. So if you are concerned or not exactly sure, your pharmacist or, like I said, the police department would probably be your best bet. So
absolutely, and look for community take-back days. A lot of pharmacies will participate in conjunction with the police department. And I mean, it sounds serious, but the police department is primarily involved because if there's any controlled substances, and a lot of those are narcotic medications or pain medications and opioid medications are involved, there needs to be a law enforcement presence. So there should be on like an annual basis, there should be take-back days in your community. Oftentimes. But yep, your pharmacy is a great resource, and again, like Angie was saying, the police station will be a great resource too.
Thank you. Well, that's the questions that we have for today. Those are some great questions. Thank you. And I want to do a special shout out to Zen for being here with us today.
It was my pleasure.
A lot of great information. Thank you. If you do have other questions in the future, please know that we are here to help you out and would be happy to answer those questions in the future. So until then, we hope to see you at our next wellness webinar next month. And we want to thank you all for attending. And please keep in mind there'll be a short survey. That evaluation will come out after the webinar closes today. We'd love to have your feedback. So thank you, everyone, for your participation today.